Well, with Gauteng recording the highest number of COVID-19 infections, reinforcements were required as the third wave engulfs the province. Military health services are being deployed here, as you just heard. The province has reported over 6,000 new coronavirus cases in the past 24 hours. SANDF Spokesperson Mafi Mgobhozi joins us now live. Mafi, thanks for your time. We appreciate it. So let's start with exactly how you'll be assisting the province at hospitals.
Let me greet the viewers of the eNCA and wherever they are. Yes, the South African National Defence Force, in particular the Military Health Service, will be assisting in the Gauteng province. The way our role in Gauteng will be as follows. We are going to deploy the medical task group, which are going to be deployed at Bara Hospital in the COVID ward. Is where our people they are going to work in the Bara Hospital.
Just Bara for now, or are you considering further deployment at other hospitals? And also, how many people are we talking about?
At the present moment, we are going to deploy the medical task group at Bara while we are preparing other medical task groups. The medical task group consists of about 60 people, which are specialists, doctors, nurses, and paramedics from the South African National Defence Force. It's 6 of them which we are going to deploy in Bara, and then we'll be preparing another team which we are going to deploy in the places where the Department of Health is going to ask us to deploy those people. At the present moment, we are not just going to Bara, but it was identified by the Health Department that we must deploy our people at Bara Hospital.
You, of course, have been speaking to the Gauteng Health Department about the situation. Given the information you've received as to why you're deploying people from within the SANDF to these hospitals now and in future, how dire is the situation?
Yes, according to the Health Department in Gauteng province, yes, in our meeting today during lunchtime, yes, they painted the situation as a really bad situation in the Gauteng province. That is why on Friday, the acting Minister of Health called the deployment of the SANDF. At the present moment, we know that the situation is bad in Gauteng. We know that with what we have, those people, the medical task team, they will go there to assist in the Bara Hospital.
And in terms of the costs to deploy these members, what is that looking like?
Yeah, it will be difficult for me to talk about the cost at the present moment. When we are in this situation, we always not talk about cost because it's an emergency situation. It's one of the emergency deployment. The Defence Force, we will pop up the resources from us, but with the aim that at the end the Department of Health will reimburse us.
Oh, but are we talking, millions here? Because this is money that basically belongs to the public. This is money that the province will have to pay you eventually.
Yes, I know that is the money which is belonging to the public, but at the present moment, for us as a defence force, whenever we are being called, we do our planning, we do our estimates, and then at the present moment, I'll say we have done all those things, our estimate, but for me it would be difficult to divide that how much money will be needed for such deployment, because at the present moment we don't know for how long we are going to be deployed in the hospital in the Gauteng province.
But can you give me an estimate then?
Like I'm saying, it will be very difficult because if I'm giving you the estimate, tomorrow someone is give you another estimate, it will be as if I'm not talking the truth. But let us leave that we have done our estimate. Yes, the Department of Defense will use their resources, everything, but with the aim that the national government will reimburse us on that money which we are going to use.
Okay, Mafi, I'm just a bit concerned about that because, this is money that the province is going to have to spend. And at the end of it, the public has a right to know exactly how much is being spent because you are the South African National Defence Force. But I get what you're saying. Talk to me about any possibility. The Premier raised concern today that people are not adhering to the lockdown restrictions. Is there any possibility of the military coming into the streets again to help police monitor the situation there?
Let me say, at the present moment, we have not received any request which saying that we must deploy the South African National Defence Force on the street. The only request which we have received is that we must assist in the hospital. That is why we are deploying our South African Military Health Service. For that, we are going on the street. We have not received any request.
All right. Thank you so much for your time and the insight. Appreciate it. SANDF Spokesperson Mafi Mgobhozi.